Good morning, my name is Kelsey Kamer from BSN 212F, and today I will be performing the Leopold's maneuver. So Leopold's maneuver is a systematic palpation of the abdomen for assessing the fetal position and the presentation. So prior to the procedure, we have to prepare the necessary equipments, which is the following equipments needed are a rolled towel, a pillow which I had already put in the patient, a record book, a watch, and also a stethoscope. So, and then next that we are going to do is we have to wash our hands. This is to deter the spread of the microorganism. So prior to going to the room, I had already done washing my hands. And then next is we are going to explain the procedure to the patient to reduce the anxiety and enhance cooperation. So hi, good morning ma'am. My name is Kelsey Kamer, your student nurse for today. May I see your wristband ma'am? Can you state your complete name?
Aiza Takadol.
And your birthday, please?
April 2002.
Okay, thank you. So, how would you like to be called, ma'am?
Just call me Aiza.
Okay, so, ma'am Aiza, would you like me to adjust the temperature in the room, or is it fine for you?
It's okay.
Okay, so today, ma'am, I am going to palpate your stomach so that I can be able to assess or determine if the head of the baby is in the lower part or in the upper part. Also, we can be able to see or determine if the back of the baby is in this side or in this side. That be alright for you?
Yes.
Okay, so I had already closed the door for privacy of the patient. So next thing we have to do is to let the patient empty her bladder before the procedure. This is to prevent the patient from being uncomfortable, and also empty bladder promotes comfort and allows for more productive palpation because fetal contour will not be obscured by a distended bladder. So may I ask ma'am if you had already voided?
Yes, I already voided.
Okay, that's good to hear. So next is we are going to position the patient on a supine without one pillow under her head and with knees tightly flexed. This is flexing knees will relax the abdominal muscles, and also using a pillow or towel will tilt the uterus of the vena cava, preventing supine hypotension syndrome. So now ma'am, since I have already put the pillow, we are going to flex the knees of the patient. So ma'am, I am going to help you flex your knees. Okay, the other side. Okay, thank you. And so now we are going to put the rolled towel in the right hip of the patient. So ma'am, in a count of 3, I will help you lift your hip, okay? Now 1, 2, 3, lift your hip please. Alright, thank you. Are you comfortable ma'am?
Yes.
Okay, so next thing we have to do is, if right-handed, we have to stand at the woman's right while facing the patient. So this is for more comfortable palpation of the patient. And then, now that we are standing in the right side of the patient while facing the patient, next is we are going to face the patient and then palpate the uterine fundus to determine what part of the fetus lies in the uterus. So this maneuver will determine whether the fetal head or breech is in the fundus, and we call it as fundal grip. So now ma'am, I'm going to roll down your blanket. Is that alright?
Yes.
Okay, so that I can be able to see your stomach for easy palpation. Now ma'am, I'm going now to touch your stomach. Okay. So upon palpation ma'am, I have observed that it is soft and there are nodulars. So, or any nodules. So it means that this part is the butt of your baby, okay? So next thing we have to do is we have to palpate in a downward direction on the side of the abdomen, applying only gentle but deep pressure to determine the position of the fetal extremities, the fetal back, and also the anterior shoulder. This maneuver locates the back of the fetus with which we call also the umbilical grip. So, okay. So, as I have palpated your side of your stomach, ma'am, I have observed that the fetal back of your baby is in this side, in the lower right of your stomach. So next is we have to place one hand over symphysis pubis and grasp the low uterine segment between the thumb and the fingers to feel the ascending part. So this maneuver will determine which part of the fetus is in the inlet and its mobility. Also, we call it as the pollex grip. So allow me to touch this side, ma'am. Okay. So since it is round and hard, ma'am, this is the head of your baby. And next is we have to turn and face the woman's feet to confirm the findings of the third maneuver and determine the flexion of the vertex. And we also call it as pelvic grip. So this maneuver will only done if the fetus is cephalic presentation because it will determine the fetal attitude and degree of fetal extension in the pelvis. And since the head of the baby is in the lower part of the stomach of the patient, now we can call it as the cephalic presentation. Now, I am going to face the feet of the patient and then do the pelvic grip. Okay. So next is we have to locate again for the back of the fetus and place the stethoscope over it and listen for the fetal heart tone for 1 full minute. This is to check if there are any abnormalities or complication with the baby of the patient. And also we have to note the location, rate, and character of the fetal heart tone to provide important information on the fetal condition. So now, ma'am, allow me to locate again the back of your baby, and since I have told you earlier that the back of your baby is in the right lower part of your stomach, then I am going to use my stethoscope to assess for the fetal heart tone of your baby. So now, ma'am, upon assessing the fetal heart tone of your baby, I had counted that it is 130 beats per minute and it's it has a regular beat, so don't worry about it because it is normal naman po. Okay? Okay, so now we have to make the patient comfortable, and since we are done palpating, we are going to get all the materials that we have put at the hip of the patient. So ma'am, allow me to get the roll towel. Okay. And now, ma'am, I'm going to roll up your blanket so that you will be comfortable, and also help you to straighten your hips, your knees. Okay, are you feeling comfortable right now, ma'am?
Yes.
Okay, so that's good to hear. So now, what we are going to do next is to document the observation made. We have to document the fetal presentation, the position, attitude, and whether the baby is engaged or floating. So, now I'm going to get the record book and document everything that I have found. So for the fetal heart tone, we have 130 beats per minute. Fetal presentation, the baby is cephalic, and it is also still floating. So the baby is not still engaged. And now, since I am done with the procedure, I am going to thank the patient now. So, Hello, ma'am. I'm done with the procedure or what I had done to you, the palpating, so that we can be able to know the presenting part of your baby. And since I am done, I am going to go out now and let you rest. Do you have any concerns, ma'am, or do you want to go to the comfort room so that we can be able to void?
No.
Okay, so since everything is alright, ma'am, I'm now going to go out and let you rest, okay? So thank you very much for your cooperation, ma'am. And that's all. Thank you.